There comes a point in life when we need to shift from growth to preservation. After the age of 60, the body no longer reacts to vitamins and supplements the same way it did in youth. The enzymes slow down, organ sensitivity changes, and nutrient absorption shifts. Yet the supplement industry rarely talks about this. In fact, many older adults are unknowingly taking substances that could be doing more harm than good. It's not just about deficiency anymore, it's about balance, timing, and knowing what the body can actually process safely after the age of 60. The way the human body handles nutrients undergoes a fundamental shift. One of the most significant and misunderstood changes relates to iron metabolism. In younger adults, iron is essential. It supports red blood cell formation, oxygen transport, and energy production. But in older adults, particularly those who are no longer menstruating or experiencing significant blood loss, the need for supplemental iron drops dramatically. Despite this biological shift, many over-the-counter multivitamins and standalone supplements continue to include high levels of iron, often under the assumption that more is better. However, in the context of aging physiology, excess iron does not behave benignly. It becomes a catalyst for oxidative stress, cellular damage, and long-term neurological decline. Iron is a pro-oxidant, meaning it can accelerate the formation of free radicals, unstable molecules that damage cellular structures, including proteins, lipids, and DNA. This oxidative damage accumulates over time, particularly in sensitive tissues such as the brain. In fact, numerous studies have shown that elevated levels of stored iron, commonly measured by serum ferritin, are associated with increased risks for neurodegenerative diseases like Alzheimer's and Parkinson's. These conditions are not just age-related, they are environment and metabolism sensitive. Excess iron contributes to this sensitivity by fostering inflammation, promoting mitochondrial dysfunction, and impairing neural connectivity. The brain, with its high oxygen consumption and delicate lipid membranes, is especially vulnerable to iron-induced oxidative stress. It's not just theoretical. Population-level research and clinical studies have repeatedly shown that seniors with higher iron stores tend to show faster rates of cognitive decline. Iron deposits in the brain are visible on MRI scans of patients with dementia, often correlating with the regions most affected by memory loss and disorientation. Furthermore, elevated iron has been linked with increased risk of cardiovascular events, as it contributes to the oxidation of LDL cholesterol, an early step in plaque formation within arteries. So, in essence, the same nutrient that once supported vitality can later fuel the very conditions we try hardest to avoid in aging, cognitive decay, and heart disease. The problem is exacerbated by the fact that iron is not easily eliminated from the body. Unlike water, soluble vitamins, which can be flushed out in urine if taken in excess, iron tends to accumulate. The human body has no active excretion pathway for iron other than through blood loss. This means that every milligram of iron consumed in excess adds to a reservoir that, over time, can become toxic. This is particularly concerning for older adults who take multivitamins daily without monitoring their ferritin levels or dietary iron intake. The well-intentioned act of supplementing becomes a daily micro-dose of oxidative burden. Some argue that iron deficiency anemia remains common in the elderly, and that is true in specific subgroups: those with chronic disease, gastrointestinal bleeding, or malabsorption issues. But blanket supplementation for all adults over 60 is not just unnecessary, it can be dangerous. The responsible approach is personalized supplementation, testing ferritin, transferrin saturation, and serum iron before introducing any additional iron into the diet. Otherwise, it's like throwing gasoline on a smoldering fire. The body might appear fine on the outside, but internally, those sparks of oxidative stress are accumulating day after day, year after year. The takeaway here is not to fear iron, but to respect its dual nature. Iron is vital in the right dose and context, but beyond that, it becomes a biochemical hazard. Aging demands precision, not generalization. And when it comes to supplements like iron, the shift should be from automatic intake to evidence-based assessment. By understanding the science of how iron operates in the aging body, we empower ourselves to make choices that extend not only lifespan, but also health span, the quality and clarity of those later years. Vitamin A plays an essential role in many bodily processes: vision, immune defense, and cellular communication, to name a few. But after the age of 60, the body's relationship with this vitamin changes in subtle but critical ways. What was once necessary in higher amounts during youth and adulthood becomes potentially hazardous in excess during the later years. This is particularly true for performed vitamin A, or retinol, which is found in many multivitamins and certain fortified foods. Unlike beta-carotene, which the body converts to vitamin A only as needed, retinol is directly absorbed and stored, and this storage can become problematic in the elderly. Among the most serious concerns associated with excess vitamin A in older adults is its damaging impact on bone density, a silent threat that can lead to devastating fractures and compromised mobility. As individuals age, they naturally lose bone mass. This process begins slowly in midlife, but accelerates significantly after the age of 60, particularly in women post-menopause due to the drop in estrogen. Bones become thinner, more brittle, and more susceptible to fractures. Now, when excessive amounts of vitamin A are introduced into this already vulnerable system, they exacerbate the bone loss. Studies have shown that high levels of performed vitamin A stimulate the activity of osteoclasts, the cells responsible for breaking down bone tissue, while simultaneously suppressing osteoblasts, the cells responsible for building it. This imbalance tilts the body toward a state of greater bone resorption, leading to lower bone mineral density over time. Several large-scale observational studies support this concern. In populations where high vitamin A intake is common, particularly through supplementation, there is a noticeable increase in the risk of hip fractures among older adults. The mechanism is believed to be tied not just to bone resorption, but also to the vitamin A's impact on calcium metabolism and the disruption of vitamin D's function, both of which are crucial for maintaining skeletal integrity. Furthermore, excessive vitamin A has been linked to changes in the architecture of bone tissue itself, making bones not only less dense, but also structurally weaker and more prone to cracking under stress. The issue becomes even more complex when we consider the dosing guidelines for older adults. Many supplements still contain up to 5,000 IU or more of vitamin A in the form of retinol, well above the recommended dietary allowance for individuals over 60. Because vitamin A is fat-soluble, it is stored in the liver and other tissues, and it accumulates over time. This accumulation doesn't always cause immediate symptoms, which can make it even more dangerous. A person may feel healthy and strong, while their bones are quietly weakening from within. This doesn't mean vitamin A is inherently bad. It is absolutely vital in the right amounts. But the problem lies in chronic oversupplementation, especially when combined with a diet that already includes ample amounts of animal products like liver, eggs, and dairy. The result is an overload of retinol that exceeds the body's actual needs and disrupts the delicate balance of bone remodeling. What's needed is a smarter approach. For people over 60, supplementation should focus more on what is lacking due to absorption issues, not on reinforcing nutrients that are already abundant in a typical diet. Bone health strategies should prioritize vitamin D3, magnesium, vitamin K2, and weight-bearing exercise, all of which directly contribute to stronger bones. Meanwhile, vitamin A intake should be monitored, and supplementation should only be introduced when a clear deficiency is confirmed through testing or clinical signs. Aging is not just about surviving, it's about maintaining autonomy, strength, and safety. A single fracture in an older adult can change the trajectory of their entire life. Loss of independence, hospitalization, and in many cases, a reduced lifespan. Avoiding that outcome requires more than calcium pills. It demands attention to the finer details of how vitamins interact with an aging body. Among those details, limiting high-dose vitamin stands out as one of the most evident. Backed adjustments seniors can make to protect their skeletal future. Vitamin E is often celebrated for its antioxidant properties. It's marketed as a nutrient that supports skin health, boosts immunity, and protects cells from damage caused by free radicals. While some of these benefits hold true in specific contexts, the story changes significantly after the age of 60. What many people don't realize is that high doses of vitamin E, especially in the synthetic form commonly found in supplements, can have unintended consequences for the aging body. Among the most concerning is the increased risk of hemorrhagic stroke, a type of bleeding in the brain that can lead to sudden, severe disability or even death. This risk is backed not just by speculation, but by data from randomized controlled trials and long-term observational studies. As we age, the vascular system becomes more fragile. The blood vessels, especially the tiny capillaries in the brain, become thinner and more vulnerable to rupture. In this setting, anything that disrupts the natural clotting process or increases bleeding tendencies can become dangerous. High-dose vitamin E has been shown to interfere with platelet aggregation, which is how blood clots form to stop bleeding. While this may sound beneficial in terms of reducing the risk of clots that cause heart attacks or ischemic strokes, it also increases the chance of uncontrolled bleeding, particularly in the brain. The irony here is striking. A nutrient taken to support cardiovascular health can end up increasing the likelihood of a devastating vascular event. One large study that highlighted this concern was the alpha-tocopherol beta-carotene cancer prevention study, which found that men taking high doses of vitamin E had a significantly increased risk of hemorrhagic stroke. Another meta-analysis published in the journal *BMJ* echoed these findings, concluding that high-dose vitamin E supplementation more than 400 IU per day was associated with an elevated risk of stroke caused by bleeding. This isn't fringe science. It's peer-reviewed research that continues to raise red flags about how we approach supplementation in older adults. The body's relationship with antioxidants is more nuanced than commonly portrayed. While antioxidants like vitamin E can neutralize free radicals, they can also disrupt necessary oxidative processes. The human body relies on a balance between oxidation and reduction. Too much oxidation is harmful, but so is too much reduction. This balance is especially important in the brain, where neural signaling, vascular integrity, and inflammation are all tightly regulated. Dumping large quantities of any one antioxidant into this system, especially in the absence of deficiency, throws off that balance and may create more harm than benefit. Furthermore, the form of vitamin E matters. The most common type used in supplements is alpha-tocopherol, which can actually reduce the body's absorption of other, potentially more beneficial forms of vitamin E like gamma-tocopherol and tocotrienols. This competitive absorption leads to an imbalance within the vitamin E family itself, narrowing the range of antioxidant protection and disrupting the body's natural chemistry. For seniors who already experience reduced nutrient absorption and increased sensitivity to metabolic shifts, this imbalance can have outsized effects. Another factor to consider is the cumulative effect of long-term supplementation. Many older adults have been taking the same multivitamin or vitamin E capsule daily for decades. Over time, this chronic intake can lead to storage in fat tissues, particularly because vitamin E is fat, soluble and not easily excreted. Unlike water, soluble vitamins that are flushed from the body if not needed, fat-soluble vitamins like E linger, building up slowly and quietly until they reach potentially harmful levels. This doesn't mean vitamin E should be avoided entirely. In food form, like nuts, seeds, leafy greens, and plant oils, vitamin E is delivered in balanced doses along with complementary nutrients and phytonutrients that modulate its effects. But the problem lies in isolated, high-dose supplementation without medical supervision or clinical need. The idea that more is better simply doesn't hold up when it comes to aging and brain health. For those over 60, it's critical to transition from general supplementation habits to more informed, evidence-based decisions. The risks associated with high-dose vitamin E, particularly regarding stroke, are too serious to ignore. Aging well means protecting not just the heart, but the brain, and doing so requires a deep respect for the delicate systems that keep us functioning with clarity and strength. Calcium has long been recommended to support bone health, especially in older adults where the risk of osteoporosis and fractures increases. As people age, bone density naturally declines, making calcium an obvious supplement choice. However, what many don't realize is that calcium taken in isolation, especially without adequate amounts of vitamin K2, can lead to unintended and potentially dangerous consequences. When calcium isn't properly directed to the bones and teeth, it can accumulate in the arteries, soft tissues, and joints. This process, known as vascular calcification, is a major risk factor for heart disease, and it's particularly relevant for individuals over the age of 60. The key issue lies in calcium's destination. The body needs calcium for many essential functions, but it doesn't inherently know where to send it. Vitamin K2, a fat, soluble vitamin that is often lacking in modern diets, plays a crucial role in guiding calcium into bones while preventing it from being deposited into arteries. It does this by activating specific proteins, namely osteocalcin and matrix protein, which regulate calcium binding in bone tissue and prevent it from accumulating in blood vessel walls. Without adequate vitamin K2, calcium supplements can do more harm than good, essentially contributing to the hardening of the arteries rather than strengthening the bones. This issue becomes more serious with age. After 60, the body's ability to regulate calcium becomes less efficient. At the same time, many older adults begin supplementing with calcium to combat bone loss, often unaware that their diets may not provide sufficient vitamin K2 to balance that intake. Over time, the excess calcium not being used for bone formation starts to build up in places it shouldn't. The result is a gradual stiffening and narrowing of the arteries, which increases the risk of high blood pressure, arterial plaque rupture, and heart attack. Several studies have confirmed this link, showing that calcium supplementation without K2 is associated with higher rates of cardiovascular events in older adults. The problem is made worse by the fact that many multivitamins and bone support formulas either do not include K2 or contain only minimal amounts. Most people are not deficient in calcium from a dietary standpoint. They consume enough through dairy products, leafy greens, or fortified foods. But because vitamin K2 is found primarily in fermented foods like natto, certain cheeses, and organ meats, it is often missing from standard Western diets. This means that when an older adult begins taking calcium supplements without also increasing their vitamin K2 intake, they're introducing an imbalance that the body isn't equipped to correct on its own. Adding to this complexity is the fact that calcium supplements are often taken in large doses, sometimes 1,000 mg or more daily, which can spike calcium levels in the bloodstream. This acute influx overwhelms the body's regulatory systems, and further increases the likelihood of calcium ending up in arterial walls. Meanwhile, without K2 to activate the proteins that would normally clear that calcium or push it toward bone tissue, the risk of calcification climbs steadily over time. This doesn't mean calcium supplementation should be avoided altogether. For some individuals, particularly those with very low dietary intake or certain medical conditions, it may be necessary, but it must be done with full awareness of the broader nutrient interactions, especially with K2 and vitamin D3, which also plays a vital role in calcium metabolism. The goal is not simply to add more calcium to the body, but to ensure it's going to the right places and doing the right job. For those over 60, protecting bone health requires more than just one nutrient. It requires a synergistic approach that includes exercise, balanced intake of calcium, and sufficient levels of vitamin in K2 and D3. Ignoring this balance may result in strong bones at the cost of hardened arteries, a trade-off that's not worth the risk. In the pursuit of health, precision and context always matter more than quantity alone. As people move into their 60s and beyond, certain physiological changes begin to take place that affect how nutrients are absorbed, utilized, and stored in the body. One of the most critical, yet often overlooked, concerns is the balance between folic acid and vitamin in B12. Folic acid, a synthetic form of folate, is widely used in supplements and fortified foods because it's stable and easily added to processed products. While folic acid plays a vital role in DNA synthesis, red blood cell production, and overall cell repair, its excessive intake, especially through supplementation, can pose serious risks for older adults. Most notably, high doses of folic acid can mask a vitamin B12 deficiency, a condition that becomes more common and more dangerous with age. Vitamin B12 is essential for proper nerve function, cognitive health, and the formation of healthy red blood cells. As people age, the stomach produces less hydrochloric acid, which is necessary to extract B12 from food sources. This reduced acid production, combined with common medications like proton pump inhibitors or metformin, makes older adults particularly susceptible to B12 deficiency. The symptoms of B12 deficiency, fatigue, memory loss, numbness, tingling, depression, and cognitive decline, and be subtle at first, but progress over time to serious neurological and psychiatric conditions if left untreated. Here's where the problem with folic acid begins. When consumed in high doses, folic acid can correct one of the hallmark signs of B12 deficiency, megaloblastic anemia, a condition where red blood cells are abnormally large and inefficient. By normalizing these blood markers, folic acid creates the illusion that everything is fine. This masking effect can delay the diagnosis of B12 deficiency for months or even years. Meanwhile, neurological damage continues silently, potentially leading to irreversible harm by the time it is finally detected. For older adults whose nervous systems are already more vulnerable due to age-related changes, this delay can be devastating. Clinical research has highlighted this issue for decades. High folic acid intake in populations with low B12 levels has been linked to worsened cognitive outcomes, including greater risk of dementia and cognitive impairment. In many cases, individuals showed no signs of anemia, commonly used as a screening tool, yet exhibited significant neurological dysfunction. This disconnect demonstrates that relying on standard blood tests alone without checking B12 status is not enough, especially in those over 60. Another layer to this problem is the widespread fortification of foods with folic acid. While originally implemented to prevent neural tube defects in newborns, a public health success, this strategy has inadvertently led to higher baseline folic acid consumption across all age groups. For older adults who already take multivitamins or B complex supplements, the cumulative intake of folic acid can easily exceed the tolerable upper intake level without realizing it. Unlike natural folate from leafy greens or legumes, synthetic folic acid must undergo conversion in the liver before it becomes bioactive. In many people, particularly those with genetic polymorphisms like MTHFR mutations, this conversion process is inefficient, leading to unmetabolized folic acid circulating in the bloodstream, which may further interfere with normal metabolic processes. This doesn't mean folic acid is inherently harmful. It serves an important role when taken in appropriate amounts, particularly for women of childbearing age, but in older adults, the emphasis should shift toward monitoring and protecting vitamin B12 status. Ideally, any folate intake should come from natural food sources rather than supplements unless there's a medically confirmed deficiency. And if supplements are necessary, they should be balanced with adequate B12 in forms that are readily absorbed, such as methylcobalamin or hydroxycobalamin. The key takeaway is that nutrient balance is not just about getting enough. It's also about not getting too much of the wrong form at the wrong time and in the wrong context. For individuals over 60, the quiet conflict between folic acid and vitamin in B12 is a clear example of how well-intended supplementation can backfire if it's not tailored to the body's actual needs. Regular blood testing, symptom awareness, and evidence-based supplementation strategies are essential to preserve neurological function and cognitive health as we age.